This is Guardian Radio 96.9 FM, Nassau, Bahamas.
The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Let's Talk Together in English is brought to you by Fort Terrace Diagnostic Center, the Bahamas' largest and most experienced dedicated radiological center. Good evening, everybody. Welcome to Guardian 96.9 FM with your favorite host, Lady T. Let's talk together. It is such a pleasure to have you guys with us on this great Sunday afternoon. I hope that everybody is enjoying themselves. Communauté haïtienne, bonsoir tout auditeur auditrice qui fréquente sous Guardian 96.9 FM avec animatrice communauté haïtienne Lady T. C'est un plaisir pour moi là avec nous. Bon dimanche après-midi ça, ma connais ça qu'a fait comment nous est-ce que nous te manger légumes avec tri jeudi parce que c'est ça me te manger mais c'est pas ça qui est important parce que nous connais émission ça là pour informer pour éduquer communauté haïtienne de tout bagaille me dit ça de tout bagaille santé nous c'est numéro 1 so tout temps me joue une opportunité pour me parler de santé nous pour me donner une information je suis content pour me faire ça après-midi grâce à bon Dieu, moi, je suis un monde qui toujours chercher bon monde dans la communauté haïtienne. Tout bon monde, yo, toujours bon Dieu côté, grâce à Dieu. So, je suis content pour me dire non. Ladies and gentlemen, it is my pleasure this evening to have my co-host with me. She's going to do most of the talking. She already knows that already. We spoke about it. Who is no other than Dr. Laura Desir.
Delrosier.
Dr. Laura Delrosier, bienvenue. Welcome to Guardian 96.9 FM. It's a pleasure to have you with us. As I mentioned in Creole, listen, I am so humble that everybody that's good always drawn to me. Such a blessing, right? I know. Doctor, how are you? It is so good to have you here.
Thank you. Well, it's a pleasure to be here. I was so excited when my husband told me that he had met you and there was an opportunity for me to discuss and talk with the Haitian community. Communauté haïtienne, c'est un plaisir pour moi avec vous, le docteur Lorphile Desrosiers. En fait, c'est Marie, moi qui fait que nous avons l'opportunité pour nous capables de parler ensemble, une avec l'autre. C'est Marie, moi qui était vraiment jump dans la communauté.
Yes.
Professeur dans l'université et c'est à cause de lui-même que moi là aujourd'hui.
And then listen, we want to give them the tea because aren't they blessed today? Mario là avec nous dans la radio. The professor is here with us to the radio this great Sunday evening. Look at God. God is so awesome. Professor, good afternoon, good evening. How are you?
Good afternoon, good evening, Lady T. It's such a pleasure to be here. Tout le monde, bonsoir, bonjour, comment nous y est? Moi, c'était nous très bien. Ou du point légumes avec
un dit blanc légumes ce soir.
Ah bon, moi
my favorite.
Et plam c'était pour moi un poisson gros sel.
Aïe.
That sounds good, right, Doc?
Avec un peu de banane fruit et puis un peu de pickles.
But is the salt good for him, Doc? Because he said he wants to have a fish.
Oh, but no
salty fish.
Marc lui-même lui gérer question celle-là, mais c'est vrai dans la communauté nous vraiment pas gérer le bien, non? Mais lui-même lui gérer le bien.
Because we love that Maggi and stuff. Oh my God, my mom when she cooks, she normally puts so much of that. Now I have to tell her, hey, you can't be using so much of that.
Ou connaît un bagage qui est très intéressant pour moi-même, moi Marc avec moi-même nous souvent à faire à parler de ça. Là où aller en Haïti, façon que monde qui sorti en Haïti cuit tant qu'on cuit manger etc. assaisonner poisson yo viande yo etc. Li vraiment différent avec façon monde en Haïti kounye à faire manger yo. Ça me joindre la caille haïtien qui en Haïti kounye yo essayer pour pas utiliser bagage qui grand pile conservation là dans son sasson goya tout type de ça yo préféré faire propre épices yo qui c'est vraiment bon bagage Et moi j'ai l'impression que moun qui te quitté en Haïti, yo quitté Haïti avec toute on capable dire messe, pas vrai, parce que c'est pas vraiment un bon bagage lié, toute façon que yo mettez en pile sel, en pile pâte tomate, etc. Mais en Haïti, comme capable dire c'est ça son bagage que nous devons vraiment by reconnaissance en communauté médecin en Haïti parce que ça son intervention que m'imagine qui te prend temps pour yo capable changer ça dans façon moun yo manger même si le fait en Haïti capable faire ailleurs tout nous capable faire même bagaille là donc toute bagaille qui grand pile préservatif là-dedans yo pas bon pour nous yo pas bon pour santé nous et nous doué dans tout moyen tout ça nous capable faire si nous capable manger plus naturel manger bagaille yo faire propre épices non haïtien nous bon dans ça d'ailleurs mais les n'a fait épices ça faut nous essayer.
For me I love that.
Oh,
because why? Listen, I have a few of my friends, right? So normally when my mom cooks, oh my God, they love her cooking. So they would ask my mom to make the ippies that she normally makes, so she can. Because what she does is she purchases everything,
Right.
like celery and onions, sweet pepper, and everything, and she blends it.
Right.
And she just
And
put,
garlic. Garlic is a
oh
big
my God,
portion
God,
of it.
don't even tell me about garlic, right?
Yeah.
She could be cooking from here, and you could smell that garlic like from a mile away.
Scallions, onions.
Right. And she would do all of that, and she would put everything and make that the apis. And so they always want the apis from my mom. And whenever the food is so tasty, like, what does she use? I'm like, she don't use the regular stuff. And she makes her own apis. And that is very important because that is healthy.
It's fresh also.
It's fresh. We may be looking at it as a small thing, but it is very important.
No, I definitely agree with you. I think that we, and you know, these things can be commercialized, honestly. These are not things that, you know, need to necessarily just be made by the individual. We can make a piece and sell it. This can be something that someone can, you know, sigo mun kaptani mo la.
Yeah, that'll be something that they did. And that is true.
I
I had somebody that did that when I went to the international fest, but they had somebody out there was selling a piece. I can't remember the name of the person, but somebody out there, they grasped that, girl. They were selling a piece out there, which was good.
It's so
and they had
good.
the cremas.
You know, you don't always have time, especially if you're a busy professional. You don't always have time to go to the store and get all the ingredients. Oftentimes you're going to several different stores, and so it makes sense if there's somebody that you trust and that's doing it and it's doing it well, then, you know, why not support that?
Yeah, that food fest was very, very good. That was almost 2 weeks ago, but that was good. You was not here.
Yeah,
that
you know,
was
I'm
like
only
the
here
18th, the
2 weeks
19th
out
around
of the
that
month.
week.
Yeah,
you missed that, but that
Yeah.
international food fest, that is the bomb. That is be good. I'm praying next year that you'll be there to witness that. Yeah, they had different countries, different kind of food, and of course, you know, I had some conch salad and comforters from our Bahamian store, and then I'm so grateful. Then I went to the Haitian store. Then I had some tasso and some cremas.
They had cremas?
They had cremas out there, girl. That's what I'm telling you. It is such a blessing. You get to enjoy both cultures in a unique and positive way.
Right.
And I'm like, wow, look at me.
Well, the nice thing is that there's so much symmetry, right? So there's so much one enhances the other, which is something that I've noticed since I've been coming here. You know, one culture really enhances the other culture, so it's. You know, I think it's really important to focus and to emphasize how we are better together.
Yes, we are. And sometimes, like, you know, Louis George is one of my good colleagues, one of my personal friends. You know, we work closely together, and I always call his name because he's been doing tremendous, awesome job in the Haitian community, nonstop. And listen, I am so grateful for that. And so we're always talking about bridging the gap with both communities, which is very, very important. Some persons are going to always stick to their ways, but you have some other persons that love the Haitian community, love the food, and love us. And it's the same for me because I always talk about, where am I going to go? This is my country. This is the Bahamas. This is the country that I love. This is what I have a whole child here. This is where my child grew up. This is my child's future. He is the next generation of this great country. So I have to make sure that whatever I do it in a way that's going to, you know, benefit this country. Because that's what we all want.
Right.
But again, like I said, some persons do not feel that way. But our job is to bridge the gap between both communities, so we can share that love, because this is a Christian nation. We could share that love together. And when I mentioned earlier, I said, I went to my Bahamian store and I had comforters and Kong salad. I felt so good, you know. And then after that, I went to the Haitian store. I'm like, you know how blessed that is?
That's amazing.
Yeah.
I mean, and the thing is that I think as people start to realize, if we look at other societies and other cultures that have flourished, the societies that really succeed are not the ones that close themselves off. The societies that do really well are the ones that are very open and seek, to improving based on what they have there. So whatever they have, they take all of it, mix it up together, and make something that's better, that's more, so when you come to the Bahamas and you're able to have, you're able to go to O Andros, for example.
I know,
and
right?
Eat,
that food is so good. Oh, shout out to Moales. Oh my God, O Andros is the bomb. I just went there last week Sunday, and Moales was like, Lady T, you here? I'm like, yeah. And, because O Andros, again, the last time you went there, I don't know how much fish they give you, right? So, I know I like to talk a lot, right? So he gave me this big fish, right? I'm like, oh my God, I'm going to eat some of that tomorrow. Then he noticed it was me. He's like, Lady T, this is Kevon, not the fish. I'm like, well, how am I going to eat all of this? And so I went home with that food. I shared that with both of my sisters.
Yeah.
That's how much food that was.
That's true. And my husband and I, we literally will, when we go, we like to go on Saturdays. And when we go, or on Sundays rather, we know that we have at least a couple of meals for the week, right? Because it's never...
Yeah, it is so much food.
You can't just eat that in one sitting.
More or less, you have to stop giving me all this food. But anyway, I'm not complaining, but I'm just saying it's good, okay? So keep up the good work. Shout out to Andres again. I love that, when we go places, especially to a restaurant, and then you ever feel like you want to eat a nice poisson blanc, right? And when you go there, it tastes bad, But when I go to Moales, if I want something at O Andros and I feel like, hey, I want some nice fried fish with pickles and bun and pizza, that is beyond point. And that's what I had to make, and that was on point.
Yeah.
So shout out to that. Because I hate that. When you don't think about something, you're like, oh, that's what I'm going to eat. And you crave that. And when you go down, it's like, you wanted to throw it away. All right, my co-host, let's talk about yourself. Introduce, you're going to introduce yourself today because you're not going to be a stranger. So I'm
actually going to have my husband introduce me.
That would be great. Because Mark, our Professor Mark, is here. He is definitely a professor at UB. I wanted him to have his own show, but God is so good. We all can have this one show together. So, Mark, how are you again?
Eh bien, moi bien, c'est encore un plaisir pour moi capable là.
Moi-même, je suis bien content de ce que nous avons. Je me sens son famille nous dans radio ça. So, je dis bon Dieu merci pour ça. Madame voulait pour introduire. The wife wants her husband to introduce her. I love it. Go right ahead and introduce our Dr. Laura to us.
C'est un beau job. C'est un beau job. Mais bon, ma petit effort. Donc, Dr. Laura, alors, dans l'hôpital, il y a les docteurs dit, mais non complet, c'est leur fil des rosiers, et avec une femme qui sortit dans le sud d'Haïti. Donc, mais souvent, on le docteur Laura.
You said they call it Dr. D. I'm going to get back to that.
Yeah, Dr. D.
I think it's...
L'hôpital de New Orleans, c'est comme ça, il y a les Dr. D. Et il y a des gens qui relèvent comme Dr. Laura. Et donc, Dr. Laura, il recevoir un diplôme et comme docteur en médecine dans le collège ostéopathique en médecine en l'année 2007. Après ça, il continue à étudier dans le domaine obstétrique avec en gynécologie dans l'hôpital universitaire Bon Samaritain. Et puis, il vient continuer à faire plusieurs études dans licence niveau de c'est parce qu'il y a un niveau post-doctoral dans la médecine parce qu'il fait à la fois gynécologie et puis urologie. Donc, lui-même, il peut parler plus qui ça veut dire urologie, qui ça veut dire gynécologie. Et donc, pour nous-mêmes qui parlons dans le domaine là, et m'a dit tout, là, on a domaine ça, où c'est un chirurgien. Donc, c'est un chirurgien, il peut l'expliquer qui type en chirurgie il fait. Et donc, il travaille dans plusieurs hôpitaux, dans New York, dans New Orleans.
Wow.
Et bon, malgré les New Orleans, qu'on y a là, il est tellement. Alors, on connaît moi qui fait étudier et tout.
Of course.
Madame est tellement important.
Tellement intelligent.
Il y a là, il sorti de New Orleans, il est obligé à faire l'avion de New Orleans et Lafayette c'est une autre ville dans Louisiana et puis là dans une autre ville encore. Lafayette il y a environ 2 heures et demie sorti de New Orleans. Mais les obligés qu'on dit aller dans un autre boîte pour
work hard.
Et il m'a dit tout pour aller by service dans on l'autre ville qui les slider tout et qui tout pour Mississippi l'offre jambe lac là. Donc et c'est vraiment un plaisir pour nous nanaso pour nous by service na by pour alors et pas moi même non pour la by service.
Non by service Paul, dans Jean-Paul parce que nous tout by service là différent. Il by service là dans docteur ou son professeur.
Oui.
So by service dans UB li même in doctor's hospital. So everybody is doing a good job. Your own is at UB, you are a professor at UB and she is a doctor at between New Orleans and Doctor's Hospital.
Ouais. Donc c'est vraiment moi-même et surtout moi vraiment content docteur Laura dans Nassau dans Bahamas pour avoir service parce que d'après ça moi connais dans domaine là pas tellement monde là-dedans.
No.
Et pas tellement connais un peu haïtien qui dans domaine là. Donc ils sont monde qui il fait urologie, il fait gynécologie, mais donc il c'est chirurgien et il gagne une série de spécialisations qui approfondit tout les mêmes capable de parler. Donc on série de niveau opération c'est lui-même qui fait et donc moi bien content pour les boys ici là pour la base service là et puis pour nous gagner communauté haïtienne qui attend de nous parler là nous gagnons mon nom ils ont pas nom qui là
qui sentiment comme là
maman nous papa nous et puis
même moi lui même parler parce que c'est nous deux qui là je dis par raison Dr. Laura go right ahead and when he's done you can go translate it and translate it in English
parler de Dr. Laura moi capable parler des jours bon ça seulement donc c'est un plaisir pour nous avec Dr. Laura présenter Dr. Laura qui a un petit plus de lui-même.
Yes, that's right. You're going to translate that in English for us.
Sure. So it is a pleasure again, to have my husband. God works in mysterious ways. When God tells you to do something, it's okay. I just want to put that out there for whoever is listening. When God tells you to follow His will, it's okay. He always makes provision.
I could tell you
I remember when my husband, when this opportunity to come to the Bahamas came up, and it was, of course, it was fraught with of uncertainty because here we are, we trained in the U.S. and we don't have any family in the Bahamas.
Well, you'll have a family now.
Well, thank you.
Definitely. Don't say such thing. Don't say such thing. God
but it is,
me for a reason.
So when God tells you, my story here is to tell you when God tells you to follow Him and to do His will, it's okay. He's going to make provision for you. So here we are now, 4 or 5 years later, since starting this journey, and Marky, my husband, Dr. Jean-Pierre, is presenting me as a urogynecologist. And so, yes, I am a urogynecologist. Urogynecologist is a physician that has either OBGYN training and then has done a fellowship, or urology training and has done a fellowship in female pelvic floor. And we can go over what that means. Essentially, I started out medical school in New York. I did my residency also in New York, and then I did my fellowship at Mount Sinai in New York. And I've been a practicing physician, urogynecologist since 2015. I'm board certified in my practice now, both in New Orleans, we're at Ochsner Medical Center, and then now I'm also at Doctor's Hospital. So I spend 2 weeks out of the month in New Orleans, and the other 2 weeks I'm here in the Bahamas, and it's a pleasure. So today I think Sam capable di, donc moi déjà expliqué en anglais qui ça moi fait, qui j'en moi arrivé là. Je pense que Sam était capable di, m'était capable ba une petite information de qui ça qui est un urogynécologue, qui ça veut dire, et puis qui type de intervention un urogynécologue capable de faire, et puis nous capable parler si il y a question. Do we take questions? Si il y a une question, nous-mêmes nous capables de demander quelques questions, en fait, de lady qui ou capable de demander des questions pour capable penser communauté capable besoin pour gagner plus d'informations. Donc, un urogynecologist, un urogynécologue, c'est un monde qui fait au moins 4 ans dans résidence dans OBGYN, ou bien elle fait 5 ans dans urologie, comme résidence. Après ça, il continue pour lui faire un bagage qui est un fellowship. Donc, c'est un postdoctorat essentiellement. Un fellowship, c'est côté où on apprendre spécifiquement de field urogynecology. Donc, l'on finit avec résidence, on est capable de pratiquer dans niveau général, mais si vous voulez pour un subspecialist, il faut faire additional training, il faut aller un côté pour capable ou plus pour capable élever le niveau. Donc, l'on finit avec fellowship là, ou à chita pour un examen, et puis l'on finit passer examen, ou à nous considérer un board certified physician. Et il y a plusieurs aspects dans urogynecology, dans urogynécologue là que nous focus sur. Donc, qui ça? Donc, moi expliquer qui ça un urogynécologue. Quand nous pourrons parler de qui ça un urogynécologue traité. Donc, un urogynécologue nous traite plusieurs aspects, mais c'est partie féminine ou partie femelle, donc vagin, ou capable penser dans vésicule là ou bien dans rectum. Donc, vagin, dans bon genre créole là, c'est côté où fait côté petite la sortie là donné, c'est côté où vient relation intime, et puis vésicule là c'est côté qui kembe urine, et puis rectum là c'est côté où aller à la selle. OK? Donc c'est ça partie ça nous plus fait intervention là-dedans. Mais on capable imaginer que oui c'est vrai, nous avons parti ça, mais en pile nous pas jamais penser de parti ça si pas un problème. Et gain bagay nous capable faire qui capable aider nous éviter problème avec yo. Par exemple, là nous gain petite, là n'a fait petite, nous gain un bagay qui relève pelvic floor therapy parce que si nous protéger pelvis là, si nous protéger vagin, là non seulement utile nous dans futur, on comprend, mais c'est bon gens que on a parlé là utile nous mesdames. La petite nous en pile dans le futur là pour éviter nous grand pile problème, mais li capable aider nous protéger nous pour nous pas gagner problème côté ou senti vagin a tomber, quand le cystocele laisser partie intérieure là cap descendre. Laisser matrice la même qui commence à descendre, ça relève urovaginal prolapse, prolapse utérin. Si c'est sous un problème avec rectum, non capable de problème quand on senti que chaque fois on senti ou besoin pour aller à la selle ou pas capable tendre, faut courir pour aller là-dedans, ça relève fecal urgency, urgence fécale, ou capable de problème que ou gain incontinence, ou pas capable kembe pour capable kembe à matière si c'est matière fécale ou bien si c'est matière urinaire, tout ça dans instant ça nous appelons les fecal incontinence ou urinary incontinence, and on capable imaginer que type de incontinence yo est affecté en pile. Donc nous dit une petite statistique que nous utilisons en pile, c'est que 40% de monde arrivé à 40 ans, 40% dans monde qui a 40 ans a des problèmes urinaires urgence urinaire côté yo connaît tout côté toilette yo connaît yo quitter la caille on va dans toilette là. Juste en cas, là, rive côté, au bralé, on bral dans toilette. Moun yo connaît tout côté toilette, yo connaît tout côté McDonald's dans la soye, parce que yo connaît que là, quitter la caille, faut yo aller dans toilette. Ou pas besoin de temps pour que c'est, les bagages la vigne tellement mal, qu'on a besoin pour mettre, pull-ups or incontinence pads, ou capable à faire une intervention avant ça. Donc, nous commençons à parler de qui ça nous couvre, qui type d'intervention nous fait. Je pense que m'a quitté Lady T pour intervention et puis on a continué.
Yeah, Dr. Laura, c'est ça que fait me pour parler parce que vous connaissez feel ça me trop bon là, de moi-même tout, c'est apprendre à apprendre. Tout le temps à parler, I am learning because a lot of things that I didn't know. Listen, that's why I'm so happy that you came here because a lot of women are listening. And sometimes, they talk about men, surgical cancer and all of those. They talk about men not taking care of themselves, but women too. You have a lot of women who are not taking care of themselves and their body. Mm-hmm. And that is very, very important. I know you said it in Creole, but if you could translate it in English, that would be awesome. I don't know if you said it in English too, but to my English listeners, because I have a lot of persons that listen in English and Creole, so that would be awesome for my being sisters and brothers that know what's going on, because we all need the information. When it comes to information, baby, we love it. So continue, doctor.
Yeah, of course. So a urogynecologist, as I said, is a person who's done either urology and then an additional 2 years of fellowship training, or obstetrics and gynecology, and has done an additional 3 years of fellowship. Either way, urogynecologists come out with extensive knowledge about and expertise about treatment that affect women, connective tissues for women, pelvic floor disorders. Of course, we treat urinary incontinence, urinary urgency, frequency, overactive bladder. We also take care of pelvic organ prolapse, so patients who have a sense of a drop or a bulge in the vagina.
1 second, sorry. Mm-hmm. I don't mean to disturb, but what can cause a woman to have that, often urinary
urgency and frequency?
Mm-hmm.
Lots of things, as first and foremost, as we start to age, the connective tissue changes, especially in our patients who are postmenopausal. There is something called vaginal atrophy, so dryness of the vagina can certainly contribute to it. And then, of course, babies, the more, the length of the second stage of labor, the number of pregnancies you've had, the mode of delivery, whether it's a vaginal delivery, whether or not we had forceps assistance, whether or not it was a C-section, and whether or not there's been any bladder injuries. Lots of things can affect the sense of urinary urgency and frequency. Believe it or not, dietary interventions can be very, very instrumental in helping that, because a lot of us we love our Cokes, we love our diets, we love our switches.
Oh, no, I love Coke soda.
Yeah. And, those are known bladder irritants. So coffee, tea, known bladder irritant, hot chocolate. I mean, the list goes on and on, right? So anything that has high acidity.
They are everything that I like.
Right. So we have to be careful with those things, because that certainly can worsen urgency and frequency for patients. And the umbrella of overactive bladder, oftentimes patients just will come in and say, well, I'm peeing all the time, but they don't. It's our job to figure out why. What's happening? Is it a dietary thing? Is it because you wake up and you've got a Diet Dr. Pepper in your hand, and then you have one for lunch, and you have a Diet Coke for dinner, or you're having, or a switcher, or we're having tea before we go to bed at night? All of those things can worsen urgency, frequency throughout the day. So being aware that sometimes it's just a matter of changing your dietary habits, and that can make a difference in terms of what your symptoms are. So certainly urinary urgency, frequency is one thing, but then there's the incontinence portion of it, right? So when you're rushing to the restroom, but you can't get your pants down fast enough because you feel like you're about to pee on yourself, right? So that's urge incontinence, and that happens with a lot of people, and there are lots of reasons why that can happen. We talked about some of the dietary things. Other things that can happen, if there is a recurrent urinary tract infection. So some patients have what we call the UTIs, the burning, the discomfort. But if you have one and you don't treat it and it's ongoing, that can cause some problems for you in the long term. It'll also make it so that you can't hold your urine very long as well. So we want to make sure that patients are aware. Things that may seem simple, it's just a
right.
UTI.
I was going to say that.
We should treat those.
Yeah, sometimes we take things for granted, and we feel like, oh, that's fine. I'm probably over 40. That's probably why that's happening. No. If you feel like, ladies who are listening to this show, please, if you feel like you're having those symptoms, go to your doctor. Check your doctor, call your doctor, get an appointment, and get treated right away before it gets worse. And if it do get worse, how worse can it get?
I mean, obviously, urinary incontinence it's a very sensitive subject, right? Because it's leakage, and you may not have control over it, right? So leakage when you are, in public, right? So
right.
I've had patients, who come see me and they're crying and they're like, here I was standing, I am a school. This is a patient who's a school teacher who's telling me the story. I'm in front of the class, and then all of a sudden there's water running down my legs.
Oh my God.
And
so embarrassing.
Those things we can avoid, and we certainly, I have patients who told me I only wear black pants because I never know what's going to happen, and I don't want to try to hide things. So I think that there are certainly, leaving this and ignoring it is not the right thing, because it, just like diabetes and hypertension, it is a medical condition. It's not all in your head. That's the other thing that a lot of women will think, is that it's all in my head. Like, this is, I can will this to be better. The reality is that this is a medical condition that requires medical intervention.
Yeah. And it's good to go and check your doctor, ladies.
Right. So we talked about urgent incontinence, but there's also stress incontinence, which is almost always related to increase in intra-abdominal pressure, right? So mostly patients who've had previous vaginal deliveries, patients who are chronically straining, those patients have an increased risk of urinary incontinence. So the patient who has stress incontinence, that presentation is different from the patient who has urgent incontinence. The patient who has stress incontinence is the patient that's crossing their legs when they cough. When they sneeze, they're like, oh my God, they're trying to tighten up their pelvic floor muscles, because that leakage happens not because the bladder is contracting, but because the urethra is weak and doesn't have the ability to help support the bladder when you cough or laugh or sneeze. And so those are treated differently, but they need to be identified, and so that you can have the right treatment for them.
Oh, wow. Okay, you guys are listening to Guardian 96.9 FM with your favorite host, Lady T, and of course, let's talk together. Communauté haïtienne, rete branché, parler qu'à côté, nous avons Dr. Laura qui toujours là, qui a bonne information, nous là dans Guardian Radio, après nous retourner back, après tu réclames ça. C'est et puis chita, s'il vous plaît, y a pris pour radiographie. C'est ça qui fait relève Saltan. Ou pas de problème dans Fort Terrace Diagnostic Center, Image at Grosvenor, nous pas jamais faire plusieurs rendez-vous résultats. Ça veut dire entrer, sortir. Si test depuis stage montre écran, radiologue nous qu'a conduit alternatif test dépistage ça. Qu'on y a la même. Ou bien, relais-nous dans 328 81 57 pour faire rendez-vous à Fort Terrace Diagnostic Center, Image à Grosvenor, ou bien relais-nous dans 328 81 57, faire rendez-vous à Fort Terrace Diagnostic Center, Image à Grosvenor, ou bien visiter location nous Kamakelod Chodia.
Are you a business owner or HR professional? RF's team of pension specialists are here to empower your employees with market-leading retirement solutions and to make implementing group pensions easy and cost-effective. With RF, starting or switching your company pension plan is a breeze, and there are no setup fees. If you're looking for strong investment performance and low fees, visit rfgroup.com/empower and empower your team to retire comfortably with RF Group pensions today. That's rfgroup.com/empower.
This November, the Nassau Guardian is celebrating 180 years. And we want to thank you, our loyal readers, for helping to make this one of the oldest newspapers in the region. We want you to be a part of our Vision Challenge giveaway promotion, beginning October 28th through November 22nd. All you need to do is find the hidden Nassau Guardian 180 Years logo, printed every day in the Nassau Guardian newspaper, and you could win prize money. Just purchase your daily Nassau Guardian newspaper every day, beginning Monday, October 28th. Find the 180th Nassau Guardian logo, cut out the page, mark the spot, write your name and phone number on that clipping, drop off your entries at our offices on Carter Street in Oakesfield, and every Friday, November 1st, November 8th, November 15th, and November 22nd, one drawing will take place. It's that simple.
Some medical facilities pride themselves on offering multiple services. At Fourth Terrace Diagnostic Center, imaging is what we do. Same goes for imaging at Grosvenor. Whether you need an X-ray, mammogram, CAT scan, or ultrasound, we have a team of board-certified radiologists on staff, on site, each with their own area of expertise. Results are submitted to your doctor within 24 hours. Call 328-8157 to schedule an appointment at Fourth Terrace Diagnostic Center or Imaging at Grosvenor today.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all of it.
Welcome back to Guardian 96.9 FM with Let's Talk Together. Indeed, I'm your host, Lady T. We do have Dr. Larry here with us. If nobody is not doing any, listen to me, if you're not doing anything today, what you need to do is listen to Guardian 96.9 FM. Touch a friend, let them know Guardian 96.9 FM right now at this 6:30 is the where to go because we have all the information at large with Dr. Laura. So, s'il vous plaît, toute communauté haïtienne, branchez, put your button on 96.9 FM pour nous cacher une information, nous besoin. Pour nous pas dire, Guardian 96.9 FM, c'est la information. Dr. Laura, welcome back to Guardian. Let's continue.
Yeah, so we've now talked about a couple of things. We've talked about what a urogynecologist is, urogynecologue. We've talked about what types of interventions that the urogynecologist manages, donc quel type d'intervention qu'un urogynécologue est capable de faire pour patient. We also talked about what types of conditions that the urogynecologist treats. So things like overactive bladder and stress incontinence. Donc, nous avons parlé de quel type de intervention urogynécologue est capable de traiter, qui c'est ça nous relève les vésicules là qui ont pile activité là-dedans, donc nous relève ça overactive bladder. Et puis nous avons parlé de stress incontinence, incontinence que l'on gagne, l'on rit ou bien tousser, etc. Pour nous allons parler de l'autre type de problème qu'on est capable de gagner dans le muscle, so chronic pelvic pain, ça c'est un problème qui en pile dans nous gagner, c'est un problème qui est dans la communauté et puis en pile nous juste résigner ou dire comme ça que OK toujours l'aime gain règle moi il toujours fait mal donc c'est ça dans cabane moi pour 3 jours si me gain règle là pour 3 jours dans cabane pour 3 jours pas capable camper pas capable lever donc ça vraiment pas normal.
It's not normal. I go through that.
No,
it's not?
No, ma'am.
Because we women already, we just so used to saying, hey, when we have our period, we know it's painful. And sometimes we can't move. Sometimes I know when I have like my first and second day, it's be terrible. And I'm always like, these women are, in Parliament all over the place. They're not making sure that women get a day off when the period is on. So I'm always like, I don't feel like women should be to work.
So, it's very interesting because a lot of people don't realize that, your menstrual cycle you can have some disease with it, but it really shouldn't be painful. When it's painful, we call that dysmenorrhea. And there's a distinction between just dysmenorrhea and something like endometriosis, for example, which is very, very painful.
Right.
Periods. The problem with just being like, okay, well, it's just I know I'm gonna be relegated to being in bed. The problem with just ignoring that is that these things can actually have health effects. So endometriosis is a condition where the endometrial glands and stroma, it's the cells that lines the inside of the uterus. So these cells are specialized cells that every month are ready for a baby. That's what the uterus does, one job, and it does it really well, which is carry a baby. So every month, those cells are like, okay, I'm ready for my baby. When those cells leave that specialized space called the endometrium and it attaches either in the deep muscle layers of the uterus or on the surface of the uterus or on the surface of the ovary or on the surface of the peritoneal cavity, which is the lining inside of the belly, that can cause a lot of pain. And the reason that it's problematic is that it increases the risk of infertility, and then it certainly increases the risk of certain types of cancers, particularly ovarian cancers. So I think it's very important for us to know that, yes, while, of course, it's not going to be, a walk in the park maybe when you have your menstrual cycle, but it shouldn't be painful. And the fact that somehow we've gotten into our heads that we expect it to be painful, it normalizes it, and it's really not normal because ultimately we end up missing. I'll tell you an example. I have this one patient, a young girl, 18 years old, and she came to see me after having seen, I think, 3 or 4 other providers, thinking that she had they just called it chronic pelvic pain. They said maybe she's got some issues with constipation.
Right.
And absolutely, yes, the young girl had some constipation, but what I saw immediately was that she has endometriosis.
Wow.
And thank God we were able to operate on her. She did need an intervention because she had a large, what we call it, endometrioma, which is a cyst that's filled with blood, because again, the endometrial cells do a really good job of preparing themselves for a baby, and when those cells adhere or attach to parts of the body where they shouldn't be, they can then form, when they're on the ovary, they can form a cyst, and every month that endometrial cell is there, it thinks that you're having a period in that location. So you can have what's called an endometrioma, which is a collection of all of these, the sloughing of the endometrium that happens within that cell, and they can grow quite large. So for that young girl, she had a 5-centimeter endometrioma. And thankfully, we were able to do her procedure. We were able to take out that cyst, and we did it minimally invasively, so small incisions. That's the other thing that I really want to bring out to the community.
I'm sorry, doctor, was that here or was that in New Orleans?
We did it. So she is actually a Bahamian patient. She lives in the Bahamas. And this was done
at Doctor's Hospital?
We did this in New Orleans. Now, the reason that we had to do this in New Orleans, this is a really good case, and I'm glad that we're speaking about it. We rarely have to take patients overseas. Most of the time we can do these cases here. However, she is 18, and when I did what's called a diagnostic laparoscopy, so it's a small incision at the belly button and 2 small incisions on the side to look what's going on. I actually had the intention of performing the surgery here. However, when I got into the belly, it occurred to me that I didn't have the tools that I needed here to be able to do an effective job. She's only 18. I need to make sure that I take out as much of that abnormal endometrial tissue as possible so I can help her to decrease the risk of infertility later on and, of course, recurrence of this issue for her.
You said you did not have the tools here?
Right. So that happens sometimes,
proceed the surgery here?
So in our field, we use different modalities. We use different tools to help us.
That is very scary.
So I wouldn't say that it's scary. I would say that this is the reality of
what I'm saying is, what if it was something, death related, where she needed to have that surgery right away and could not afford to go, away.
Mm-hmm. I mean, unfortunately, that is the reality that we.
That is very scary.
I will say that that is something that we're trying to change.
That is something that
one
needs
of the
to be changed,
reasons,
Dr. Laura, because people's life are at risk.
One of the reasons that we've been such a big advocate for minimally invasive surgery is that it is the standard of care. And we still struggle a little bit with that in the Bahamas. We're working really hard to bring this to the Bahamas, but it's still, there's still times when patients are not having access to small incisions, surgeries that allow for small incisions in the belly. And I want to just make sure that patients know that is an option. Certainly at Doctor's Hospital, there are very few times when we are not able to perform the surgeries because of the degree or the severity of the procedure. The types of surgeries that we do are mostly minimally invasive. So we're using small incisions called laparoscopy, a small camera that we place in the belly button or just below the belly button, and we use that to help us to see inside of the belly. We then use small instruments that are an extension of our hands inside of the pelvis that helps us to do these surgeries. And for the most part, I would say 90 to 95% of surgeries can be done with what we call straight stick laparoscopy. We've done a ton of them. And there are several physicians in Nassau that do this procedure as well. However, as time, just like anything in medicine, we're always pushing the next envelope, pushing things forward. There is also a laparoscopic procedure where we use an instrument that's called a robotic laparoscopic approach. So it is an instrument that allows us to have 360 degrees, so it allows us to move our wrists in the same fashion that you would use it if you were operating on the patient directly. It allows for better visualization. It has a 3D camera that allows for better visualization closer up, and you can really see what's going on. You magnify a 1 millimeter item that you can see it on a screen at a much higher level than you would be able to see either with an open procedure or laparoscopic. We do not have a robot in Nassau. So when there are cases where we really need to use this tool, which is the robot, right? The one that I use in particular is the Da Vinci robot. However, there are several others throughout the world. India has one. I believe there are several that are produced in China as well. Be that as it may, the robotic surgery is not standard of care in the world, but certainly I believe in the next decade, hopefully it will be. But certainly laparoscopic surgery is standard of care for a lot of what we do, and so I really urge and encourage patients that if you are having surgery, seek out and ask if you are a candidate for a laparoscopically or a minimally invasive procedure, and ask the questions. And I think as a patient, you always want to know that, we are not going to be upset with you if you ask, am I a candidate for a laparoscopic procedure? Or if you say, well, if I'm not a candidate with this person, is there anyone on the island that can help in that regard?
But Dr. Laura, how dangerous are those surgeries?
I think that there's a big worry about surgery being dangerous.
Right.
Surgeries should not be dangerous. Now, are there
from
episodes?
a woman perspective, because it has a lot to do with us, because that's the kind of thing that you do.
Yeah. So these are surgeries where we are helping to improve the quality of life. First and foremost, before you have surgery, you're going to have a full evaluation to make sure that you are healthy enough for surgery, that the surgery that we're going to do is going to actually be the correct one for you. So it oftentimes requires imaging that allows us to see what is it that we're dealing with and to make sure that there are no other areas that need to be further evaluated prior to surgery. So I think that there's such a worry about surgery in the Bahamas. Everybody's like, no, surgery is the last thing I want. In fact, sometimes I think that does more harm than good. Surgery is not for everyone, and when you come to our offices, we're never going to suggest surgery as being the first and foremost thing that we do. However, when you delay surgery to the point where things have gotten so bad that it's the only option that's left, I think it actually makes it a little more, it makes the surgery more complicated and more difficult for the provider, but it also makes the recovery harder for the patient. So just like I would say, when somebody has diabetes or hypertension, don't wait until you've got a black toe that is gangrenous and then go to the doctor and say, hey, I think I need to take care of my diabetes.
I know, right?
At that point, we have, no amount of, insulin is going to fix that toe, right? It's gangrenous. It's past that. We have to think about the same thing for these types of procedures. Don't wait until, you're bleeding, you're passing clots, large clots, you feel like you're fainting before you have an intervention. By that time, you're really making the surgery more difficult for yourself, right? Because you've let it go so far. So being aware of, okay, what is normal, what's not normal, and then when I start to see things that are not normal in my body, let me look for an intervention. Let me look to speak with a provider. Let me ask my primary care doctor to actually, can they do some testing? If not, can they send me to someone who can appropriately evaluate me and treat me earlier than later?
Wow. So when it comes to women with fibroids, right? You have a lot of women out here now, I would say, that has fibroids. The first thing that they tell you to do is you would need a surgery. What can you say about that concerning fibroids? Because I have about 3 of my friends now that has fibroids.
So I think understanding the reality, the studies show anywhere between 70 and 80% of Black women have fibroids. So that's a lot of people. So if you put 10 people in a room, 8 of them have fibroids.
Yes.
Not all fibroids are going to be symptomatic, but as we age, we are more likely to have symptomatic fibroids. So first and foremost, if you need to follow your periods and see, are there changes? If there are changes, what are those changes? If those changes start to increase the amount of bleeding, if you then see that there is an association with anemia, or your doctor says, hey, you're bleeding so much now you're anemic, then there needs to be an intervention. The intervention is, I don't believe that there are any providers that's going to say surgery is the first step. It never is. It's a part of the algorithm. It's a part of the treatment modalities. But I don't think that surgery is ever going to be what we say you have to have right away. Typically, it's going to be, well, let's put you on some birth control. Let's see if we can actually control the bleeding if this is a fibroid issue. Let's see if we can monitor it. If you have a small fibroid and it's really not causing pain, or it's not causing a lot of bleeding, then we just watch that, because if you're close to being perimenopausal or postmenopausal, that's going to resolve on its own when you're no longer having periods. The modality of how we treat a patient is going to be different based on their age, based on what their lifestyle is, based on their body habitus, meaning, you know, whether we're if we're dealing with a lot of other medical problems as well. All of those things are going to be interventions. All of those things are going to sort of contribute to how we make an intervention for a patient. So typically, it's going to be medication. We'll give you, there are medications that you can take orally, medications that can go place right into the uterus itself. They're called IUDs. There are injections that we can use. And then there are procedures that can be done. Sometimes we need to look inside of the lining of the uterus. It's called a hysteroscopy. And that will help us to see, because a never event is, you know, missing someone who has an endometrial cancer, right? So we don't want to say that this person who's in front of me, they're bleeding just because they have the fibroids, but we've missed the fact that the endometrium is thickened and that the cells inside of the uterus are becoming abnormal. So sometimes it requires us to do either biopsies of the tissue, which can be done in the office, or a small look inside of the uterus to see what is going on there. And then surgeries are an option, interventions. Surgical interventions become an option. And the surgical interventions don't necessarily mean a big cut in the belly. Sometimes you have fibroids that are in the lining of the uterus, and so a hysteroscopic resection is an option for you. It's a procedure where we actually use a device to remove or shave off the fibroid that's within the endometrium. That's a good way of managing it for patients. Other times, you may be a candidate for a laparoscopic procedure where you have a small incision in your belly, and we're able to remove the fibroid through those small incisions. Either straight stick laparoscopy or robotically, depending on the number of fibroids and their location. Sometimes you need to use the robotic device to help you. The tool, right? The robot is a laparoscopic procedure, but it helps us it's a tool that allows us to have to refine our surgical technique. And then lastly, sometimes you need to have an open procedure because either the location or maybe concomitant things that are going on. So yes, although surgery is certainly in the algorithm, meaning that is one of the things that's one of the ways that we manage fibroids, it most certainly is not. I will tell you, though, that there is a tendency to wait. So we wait and wait and wait and wait until now we come in and, you know, I'm looking at a patient. This is an actual patient. I walk in and I'm looking and I'm like, oh, wait, I'm the urogynecologist.
Right.
Because you look like you're 6 months pregnant. You need to be seeing the obstetrician.
Right.
And no, we're not pregnant. It's just we have clearly ignored this. Right. And you know, sometimes it happens out of fear. It happens out of, you know, I'm really afraid. I don't know what's going to happen. Or out of, you know, I need to take care of everyone else. I've got my husband, I've got my family, and you know how we do. We've got, you know, we tend to live in families, right? So, na prend soin tête nou, na prend soin mari nou, petite nou, maman nou, papa nou, cousin, cousine, and the last person that we take care of is ourselves, right? So
and that is so true. I'm glad that you switched to Creole, because I would say that one of my friends, right? Well, I did say I have a few friends that has fibroids, but one of them in particular is a Haitian. And, you know, the way she acts about it is so scary. Oh, you know? they take that very serious. What can you say to the Haitian community, that are listening at large now? Maybe the women, because it is concerned women that has fibroids now. Communauté haïtienne, so ka di moun ki gen free bomb, fi yo kap kote émission qui gen free bomb, mais qui pense free bomb nan c'est lui même qui a fini avec la vie ayo, because that's how they take it, like it is the end of the world, that they have fibroids or their life is at risk. The Haitian community can be very dramatic at times because again the lack of information.
Right.
So what can you say to them?
Lack of resources.
The lack of resources is correct.
Yeah.
What can you say to them that are listening at large? Also, you can say that in Creole so they could understand.
Of course. Donc moi pense que ça sont très important, une question qui est très importante. Et moi voulais pour moi mettre emphase sur quelques points. Fibrome affecté entre 70 à 80% de filles, et spécialement filles noires. Donc, là où on dit comme ça que on a fibrome, ou bien on senti que matrice là a élargi, c'est pas, on pas besoin automatiquement penser que c'est cancer, etc. Fibrome, c'est une condition benign, so qui pas une condition qui pas de cancer là-dedans, et il affecté gagne partie 80% de femmes noires. Donc c'est un bagage qui est assez fréquent. Problème que je pense qui arrive, c'est que nous en pile temps retenir pour fibrome non fait que nous gagnons pile maladie. Par exemple, les ou gagne fibrome ou capable saigner en pile. L'or chita ou appeler saigner, ça peut arriver. Ou gagne anémie. Là où il y a anémie, si il y a aucun autre problème médical, la fait que la accentuer ça, la fait que il vient plus mal, la fait il vient plus difficile. Là où il y a anémie, ou pas capable de marcher bien, parce que la pas affecté façon que cœur a battre, la fait cœur bat plus vite, là où a anémie. Et si cœur a bat, qu'on y a, on met un stress, on met ou effort additionnel pour cœur, non seulement pour capable prendre soin, faut le battre sang, pour capable passer dans tout le corps, pour aller dans le cerveau, pour aller dans pied, dans main, etc. Qu'on y est dans rein, etc. Qu'on y a ou gain un problème côté cœur capable affecter, ou gain un problème qu'on y a ou anémie pour longtemps, ou ça nous relève decondition parce qu'on n'est pas capable de marcher bien ou pas capable de faire effort que quoi t'as fait normalement, qu'on y a un problème dans le rein parce que sans que rien vraiment sensible, faut rien gagner assez sans cap circuler là-dedans pour capable travailler dans maximum pour capable gagner effet que les besoin pour gagner effet dans corps là, c'est lui même qui pourrait tirer tout extrêmement dans corps, tout ça qui passer dans corps, tout bagage ou mettant dans bouche la passer pour passer dans foie et puis c'est rien qui va laver tout ça kounya ou pas de problème dans rien. Donc moi comprendre parce que me penser dans communauté nous exemple côté moun mouri moun gen en pile problème parce que pas bien gérer problème il pas bien gérer fibrome que gain en effet gain exemple de moun qui vini yo mouri yo gen crise cardiaque etc. parce que yo sévèrement anémique. Me penser que li très très important. Là nous dans situation ça, c'est pour nous mettre pieds nous dehors pour nous chercher aide que nous besoin. Premièrement, nous besoin pour nous gagner consultation. Ou pas besoin pour aller un spécialiste ou capable commencer avec médecin que vous suivez normalement. Mais l'on parler avec médecin, on fait connaître tous symptômes ou pas kembe rien, ou pas serrer rien parce que li plus bon, yo dit comme ça que qui ça comme un proverbe maman papa me dit en fait c'est papa me qui te toujours dit ça la averti pas tout kokové. Donc moi c'est que c'est très très important pour capable premièrement commencer avec where médecin ou faut yo faire un type de imaging, faut yo faire un type de évaluation pour yo garder est-ce qui bon fibrome nan yé, qui grosseur li, qui ça que la qui côté la peser, est-ce que la peser sur artère yo qui dans pelvis là, ça capable gagner effet ou capable gagner what's called a DVT, get toutes sortes de problèmes qu'on capable gagner si yo pas vraiment évaluer bien. Donc faut gagner un imaging ultrasound ou sonogramme, c'est une façon qu'on est capable d'évaluer li, ou un MRI. MRI, c'est une façon que qu'on est capable vraiment ouais qui ça capable passer dans pelvis là, non seulement dans matrice là, mais on est capable ouais l'autre organe qui bon côté les adjacent organs. Donc, je pense que ça faut nous commencer mettre pied à terre. Al wè médecin ou, mande pour yo faire imaging pour either ultrasound or an MRI ou a besoin, et puis pour capable, then, si vous commencez, ouais, que, ou pas joindre une réponse qu'on gagne, ou capable besoin pour un spécialiste, ou capable besoin pour demander pour un OBGYN, et gagne OBGYNs dans Princess Margaret, obviously, gagne OBGYNs qui dans communauté en pile monde, et puis l'on parle avec yo, ou capable dire symptômes qu'on gagne, depuis qu'il a commencé, qui ça a senti. Et puis, là, on commence à parler de traitement. Je pense que faut ouvrir les yeux pour tendre, ouvrir les oreilles pour tendre bien. Ça va dire que traitement que mon a ou si vous avez une difficulté ou bien ou pas tellement sûr de lui-même que vous obligé à aller avec premier, ou capable demander ça un second opinion, ou capable aller ou l'autre monde pour capable assurer que ça y a là ça monde qui capable devant là information que la baoua que non seulement les correct mais que les correct pour eux-mêmes parce que les capable correct mais les capable passer par ça ou même au besoin. Je pense que dans médecine il est très important que gagne ça relève the patient doctor relationship que yon capable ouais avec l'autre. Là ou pas gain ça, li ba en pile difficulté parce que ça monde qui campé devant là faut gagner faut capable gagner trust dans lui-même, faut gagner faut capable non seulement comprendre lui mais gagner trust dans lui-même croyance dans lui-même, faut gagner croyance dans lui-même et puis faut lui-même capable comprendre nous bien. OK, je pense que je parle un peu sur ça, donc on va connaître en l'autre intervention.
Okay. I want to ask, right? The majority of women, again, we fear that when we have fibroids, we're not going to have any kids that prevent us from having kids. From 1 to 100%, how accurate is it?
So fibroids is a risk of infertility. It's well documented, and that's why it's important that there is an evaluation. The risk of infertility changes depending on the location of the fibroid and the extent of the fibroid and the number of fibroids that you have. So we know that 50% of women with fibroids will have infertility issues, right? Mm-hmm. But and that's why location and it's so important to know where the fibroids are and what effect they're having. If the fibroids are in the lining of the uterus, well, there are obvious ways that you can intervene with that, right? Mm-hmm. So just a small intervention, a hysteroscopic resection or shaving off of that fibroid increases fertility significantly. If the fibroid is a large fibroid and it's in the muscle layer of the uterus, well, sometimes it requires you to do a myomectomy where you remove that fibroid because mm-hmm. as the uterus is growing, when you're pregnant, as the uterus is growing, that can have an effect. Let's just say that you did have infertility issues, you finally got pregnant, but you have a large fibroid. That can actually affect the fetus. It can actually cause issues with growth restriction for the fetus. So I think it's important to recognize that. Now, having said that, again, that's why it's important to start working on these things early.
Right.
If you have fibroids, and you're close to 30 or 35, and, you've got a little bit of endometriosis, all of those things make fertility really, really difficult, right? Because in those instances, you have three things which all can contribute towards infertility. And one thing that I'd like to say, I know that I feel like there is not enough discussion about infertility, mm-hmm. particularly within the Black community.
Right.
And I feel that oftentimes it's those of us who worked really hard, did all the right things, left everything off to the side and decided that we were going to push forward. And oftentimes, by the time you realize, oh my God, it's time for me to have a baby, and we've let all these years go by. So infertility is a problem that affects all women. It is particularly a problem within the Black community. And you'll probably have to I'll come another time to specifically spend some time on infertility and what are some things that can be done ahead of time to help decrease that. Now, to discuss, one last thing I want to discuss with you that I think that people don't realize there is this option in Nassau. Mm-hmm. There is uterine artery embolization. So for patients who have completed their have completing their childbearing years and they're not interested in having babies anymore.
Right.
There is a good modality that doesn't require surgery called uterine artery embolization. It's a test. There is an imaging test that needs to be done where you take pictures and you can see what's the blood supply to the fibroids, and they use this medication that basically is this foam-like medication that essentially blocks the blood supply to the fibroid. It is offered here, and I think that it's always important for patients to kind of see what are, what's available to them. There is an interventional radiologist, and I don't know what the rules are here. I may not be able to say names, but I think it's important for people to know that there is a non-surgical option for patients who have fibroids, and it's a quick intervention with very, very high success rates for patients.
Awesome. But you're looking for the information that you can share with us. Like I said, information is always important. To share communauté haïtienne, autant de docteur Laura, j'en ai expliqué nous. Des fois, bon, me demander des fruits bon, est-ce que si on moun gen fruits bon, est-ce que ou ka fait petit? Me demander ça en anglais. How high is the chances with women that has fibroids when it comes to, having a child? C'est ça me demander en anglais. So, m'a demandé ça en créole, puis ka traduit ça pour moi en créole, puis dit comment chance là est pour fille qui gagne fruit bon, combien chance you vont avoir like from 1 to 1 à 100 pour d'esque et the risk, comment il risque pour les faire timoun, est-ce que ça possible pour moun qui toujours gagne fruit bon comme fille pour faire timoun ou ka dit ça?
Oui, bien sûr. Moi j'aime t'ai expliquer c'est que oui là on fait fibrome ou gagne ça nous les infertilité, gagne risque d'infertilité, même pense que c'est très important pour nous toujours ouais patient dans unité culière, right? Pour ouais moun en soi que lui-même, parce que c'est pas tout patient qui gagne fibrome qui gagne même présentation fibrome là capable non côté le pas affecté en dans matrice là.
Okay, Dr. Laura, just hold that thought for me, please. It's time for our break. You guys are still listening to Guardian 96.9 FM with Fresh News, Smart Talk. Indeed, I'm your host, Lady T. It's a pleasure to have you guys with us. Please tune in. We will be right back after this break. Communauté haïtienne, nous toujours branchés dans Guardian 96.9 FM avec animatrice Communauté haïtienne Lady T. N'a pas retourné après réclame.
Some medical facilities pride themselves on offering multiple services. At Fourth Terrace Diagnostic Center, imaging is what we do. Same goes for imaging at Grosvenor. Whether you need an X-ray, mammogram, CAT scan, or ultrasound, we have a team of board-certified radiologists on staff, on site, each with their own area of expertise. Results are submitted to your doctor within 24 hours. Call 328-8157 to schedule an appointment at Fourth Terrace Diagnostic Center or Imaging at Grosvenor today.
Around the world, Cleveland Clinic is recognized as a leader in healthcare. Our team of experts relentlessly pursues the best for our patients. From groundbreaking cancer research to state-of-the-art heart surgery, life-saving innovations happen here every day. When it's time to travel for your health, it's time to travel to Cleveland Clinic, your destination for care. for every care in the world. To learn more, visit clevelandclinic.org/Caribbean.
Seyen epi chita, s'il vous plaît. Yak rele pour radiographie. Kale. C'est ça qui fait rele Saltan. Ou pas gen problème dans Fort Terrace Diagnostic Center, image at Grosvenors, nous pas jamais faire plusieurs rendez-vous résultats. Ça veut dire entrée sortie. Si test depuis stage montré écran, radiologue nous ka conduit alternatif test dépitage ça. Kounya la même. Ou bien, relez-nous dans 328 81 57 pour faire rendez-vous à Fort Terrace Diagnostic Center, image à Grosvenor, ou bien relez-nous dans 328 81 57 faire rendez-vous à Fort Terrace Diagnostic Center, image à Grosvenor, ou bien visiter location nous Kamakelod Chodia.
This is Guardian Radio, your station for up-to-the-minute news, intelligent, interactive, and engaging conversation. 96.9 FM.
All right, welcome back to Guardian 96.9 FM with Fresh News Smart Talk. Indeed, I'm your host, Lady T. You are still listening to Let's Talk Together, communauté haïtienne. Bienvenue à En nous parler ensemble avec animatrice communautaire Lady T, côté n'a éduqué et n'a informé de santé avec le docteur Laura qui là avec nous comme co-host. Nous allons parler plus parce que c'est lui qui gagne information en pile bagaille dit moi pas connais moi même c'est des informations. That's why she's my co-host, and that is why I'm letting her talk a lot, because I need the information for myself, okay? So, Dr. Laura, go right ahead. We're going to pick what we left off. I asked, in Creole, I asked, how high, let me say it in Creole, like I said. Sometimes I get mixed up between the English and the Creole, right? Comment lier pour moun qui gen free bomb, quand une femme qui t'a fait petite, pour qui gen free bomb, comme une femme pareil, moi, et comment chasse là pour lui et si tu as fait petite est-ce que vous comprenez me connaît ça son bagage qui vraiment danger mais so ka dit dans ça.
Moi pense que ça me donne mais ou disons bagage que moi voulais pour moi qui attire attention moi li vraiment danger. Je pense que tout ça que nous voyons là, nous capables de penser que les plus ou moins dangereux parce que nous pas gain information pour lui. Réalité c'est que j'ai déjà dit que fibrome affecté upwards of 80% d'ammoun finnois. Donc c'est un bagage qui est très très commun. Moi c'est ça qui est important, c'est que nous toujours essayer pour nous traiter individus qui campent devant nous. Donc, c'est son monde qui est très jeune et puis il y a un gros fibrome. Donc, naturellement, n'a pas parlé de qui j'en ai capable de faire intervention pour lui. Mais c'est son monde qui presque a privé dans l'âge côté le bras l'entrée dans ménopause, nous avons une approche qui est différente. Pour monde qui t'a jamais fait petite, il est important pour nous connaître qui dans quel niveau fibrome là est-ce que c'est en dans matrice là, est-ce que c'est dans muscle matrice là, est-ce que c'est dans ça nous les endometrium là, est-ce que c'est est-ce que sont pedunculated, son bagage qui gon ti stock ou on ti bagage qui embelli et puis la grandi on l'autre côté. Faut nous connaître que qui type de fibrome parce que fibrome là c'est pas tout yo pas tout fait même yo pas fait même genre. Donc faut nous comprendre ça. Premièrement, oui, il y a un risque pour une infertilité là où il y a fibrome, mais premièrement, nous besoin pour nous évaluer moun qui gagne fibrome là pour nous capable balayer un pourcentage parce que moun qui campé devant là, pourcentage là plus ou moins différent dépendamment qui gens yo présenté.
Okay, so I know you work at Doctor's Hospital, right? To God be the glory, He's given me good health. So, but I've heard a lot of stories when it comes to Doctor's Hospital. I know you do surgeries down there. And for somebody that don't have insurance and that would like to have one of those surgeries that you've been talking about at Doctor's Hospital, how costly it is? Do you have any idea? Because, sometimes people tend to be so scary. They're like, oh, doctors and hospitals, it's so expensive, the amount of money that they charge. And for somebody that don't have insurance, again, it's not like, you have an 80-20%, like you're going to cover 20% and your insurance will cover the 80. So you have no insurance and you want to have a surgery, to that magnitude, which sometimes can be, like you said, but I'm pretty sure I'm gonna give my life at your hand, because I'm definitely sure that you knows what you're doing, so I'm gonna trust you, right? But yeah, just to say you want to go and have that procedure done at Doctor's Hospital, do you have any idea?
I mean, so in general, surgeries are going to vary. It depends on what procedure you need to have done. So I think that it's always important to work with the provider who you're seeing so that you can get the best procedure for, the best amount, the most cost-effective route. I think oftentimes when it comes to health, we sometimes will relegate our health to being secondary, right, and focusing on all the other things in our lives. But you can't do anything else if you're not healthy.
No, that is so true.
So in terms of cost, it's always going to vary depending on what procedure you're having done. I would say that the minimally invasive procedures tend to be a little less costly because they get you out of the hospital quicker. But I think, it's always important to know, what do you have in front of you, and so you can know what the best option is. It may be that you just need to have, you may think, oh, I have fibroids and automatically I'm going to need surgery. It may turn out that you may only need an IUD.
Right.
Maybe a Mirena IUD that helps to control the bleeding is all that you need. You don't need surgery. So I think it's important. That's why evaluation is so important. And evaluation with an open mind, knowing that, okay, well, maybe I think I need this, but maybe that's not what I'm going to need. And it's our job as medical professionals to make sure that you come out with the information, with the knowledge that helps you to make good decisions. Ultimately, we are partners in our patients. We are partners in the care of our patients. We can't dictate what the patient must have. We can say this based on the information that's presented in front of us. We believe that the best outcome is going to be A, B, and C. And the patient has to then take that information and make their own decision on what's going to be the best option for them. Now, I've had plenty of patients that have said, listen, I don't have insurance. Is there a way that you can work with me? Absolutely. We have lots of payment plans. And in fact, Doctor's Hospital has been doing an amazing job of pushing payment plans that will help patients to get the care that they need and then allow them to pay it off over time. There's the LAMP program, which has just been doing an awesome job at having patients have access to either imaging or lab work, and then of course there's a pharmaceutical component to it. Obviously, I'm not a representative of the LAMP program. I'm just telling you from my interactions with the LAMP program. I think that the vision that I see, which I really like, is that we want to give patients options to treatment modalities that's going to fit their lifestyle, that's going to allow them to have the best outcome possible. There's no doubt in 2024 that minimally invasive surgery is the best route for surgery. There are thousands of papers at this point over the past 25 years that have demonstrated that when you use minimally invasive approaches, so laparoscopic approaches, vaginal approaches, etc., that there is less blood loss, that there is a quicker recovery, that you are less likely to have injury to adjacent organs, and that the patient can get back to doing what they need to do to take care of themselves and their family quicker. There's no doubt about that. So the question is, are patients aware of that? Do patients know? And my belief is no, because so many patients, by the time they come to see me and I explain to them, they're like, oh my gosh, I have never heard of this. I never knew that you can have, surgery with these small incisions. I never knew that was an option for me. And with that in mind, they can make up their own decision on what works best for them. It's my belief that, we take care of everything else. We make sure that we look good. We got, our hair is right. Our bodies are snatched. Our nails are good. We take care of everything else.
Except
our
health.
I think it's important for us to invest in ourselves.
Okay, so what you're saying is that sometimes persons can just, be, what's the word I'm looking for? They can be a little exaggerate. They could exaggerate a little bit when it comes to doctor's hospital. It is not so. It is not as costly as people make it seems to be. You guys have payment plans and they can go in and see your doctors. It is affordable.
I would say so. I mean, I've made it my mission to make sure that my consultations are affordable. And we work with patients. Ultimately, we want to make sure that our community is healthy. That's what's most important.
Yeah,
nous voulons assurer que communauté nous est healthy. And moi voulais pour moi dire comme ça que there's precedent, précédence dans communauté a déjà des médecins qui travaillent avec patients, yo côté yo mettez son payment plan, yo parler avec yo. Évidemment ça c'est travail nous, donc nous besoin pour nous capable vivre à travers travail nous, mais nous voulons que nous pas capable coincer communauté, nous pas voulons pour communauté à penser que yo pas gain accès. Moi tendais ça gagne monde qui dit doctor's hospital il tellement cher mais yo pas jamais fait consultation yo pas jamais aller pour yo demander qui j'ont vraiment connaît qui ça qui quoi pas jamais essayer
même petit choix utiliser au charge pour lui.
Moi, je crois qu'il est très, très important que nous informer tête nous, même gens que nous avons information dans la communauté, parce que pour nous essayer.
Please stop judging doctor's hospital, okay?
C'est pour nous essayer
they are not as expensive as you guys think.
Et puis non seulement ça, I mean, at the end of the day, je pense que moi je vois un pile monde qui dit comme ça que si on veut son bagage c'est doctor's hospital pour aller. Donc nous est déjà établi que c'est là qui gagne accès, c'est là qui gagne instrument que nous capables d'utiliser, c'est ça qui a nous accès à médicaments que nous capables besoin.
Dr. Laura, everybody wants what's best for them. Everybody would like to go to, a hospital where they know they're going to be treated well, where they know things are going to happen, and they just going to pray, because after God is the doctor, and they know, hey, they're going to come out successful. Everybody would like that. But again, like I mentioned before, a lot of persons don't have insurance, and health insurance in this country is very expensive. You're looking at the middle class. When it comes to the middle class of having an affordable insurance and then, to live. How can you do all of that? You have bills, the minimum wage is, just say the minimum wage is $2.60. You have a regular family that needs urgent care, or urgent surgery right away, and doctor's hospital can give them that. But I'm going to say again, what funds they would have to go there. Yeah. And that has always been the problem.
Right.
It's not the fact that they don't want to go, they want to go. But how can they afford it?
Well, moi, c'est que ça, I mean, question que moi, c'est une question qui est très, très importante. Pas quoi, c'est une question que même moi, capable de répondre. Parce que moi, c'est ça, this is a question of national health care and health rights.
It is.
And moi, capable de, having been someone who's worked in many countries, I've done medical missions in many continents, moi, capable de dire que ça, moi, dans Bahamas, là, c'est un système qui progressive qu'a essayé pour avancer pour moun yo. Gen côté que ou pas gen l'argent, it doesn't matter, ou pas joindre aide que besoin. Whereas in the Bahamas, sou pas gen l'argent, ou joindre aide quand même, ou joindre moun qui capable aider, ou joindre moun qui essayer aider. Donc moi c'est que faut nous plus focus sur ça que nous gagner et peut-être pour nous capable ça nous pas gagner pour nous capable juger l'ensorte mais pour nous capable avancer vers l'avant. Ça c'est une gros question de health access to everyone. Bah c'est avec le temps parce que moi j'ai un programme qui est initié dans Bahamas qui voulait avancer pour monde plus accès avec le temps. Mais je pense que c'est très important pour monde qui gagne problème kounye pour pas juste dire pour pas faire mes yeux pour dire comme ça que OK m'pas jamais joindre monde qui pour aider moi. aller pour faire une consultation et puis ouais avec Dieu pas pour capable voir si son bagage qu'on capable engager là-dedans ou sinon et puis ça me joindre ici moi voulais pour moi discuter ça me joindre ici là c'est que médecin yo réellement remet patient yo même si yo pas joindre que yo même yo capable aider y a fait tout ça yo capable moi gen un exemple de une dame qui t'est voyé un patient ban moi nous pas jamais charger dame là nous li nous pas les bons gens soins tout nous pas jamais charger non nous pas capable faire ça pour tout le monde c'est médecin nous y en a travail etc mais gagner tant que ouais mon ou obligé faire tout ce capable pour faire nous engager plusieurs monde qui fait ça pour tout nous pensons que l'important que nous reconnaître que communauté médecin nous pas là seulement pour nous prendre mes patients nous vraiment remet ça nous fait nous remet nous notre responsabilité pour nous prendre.
That was the main question I forget to ask you. What made you become the doctor that you are today? Because I see that you have such a passion for it, and I admire that so much. Because it is so important to know to go in a profession where you love what you do and you love the people again. Before I let you answer that, persons tend to be so scared when it comes to a hospital. I'm not even going to say doctors, but I'm going to say PMH. You know, I've had a lot of my friends personally and said, "Girl, I'm not feeling well, but I'm not going to PMH because I'm seeing the way that they treating people and I'm seeing what they're doing." But to tell you the truth, I've been there last week and I've seen that tremendous improvement from PMH. I think they're doing a great job. The doctors, they're doing a good job. The nurses are doing a good job. Maybe, you know, in every institution or organization, you're going to find one or two bad apples, but you cannot let that determine who they are and what they stand for. So I want to say that too, but yeah, you can answer. You can go right ahead and answer the question. What made you wanted to become a doctor? Because, you know, I just love the inspiration.
Donc, moi, je dis ça en créole parce que je pense que capable gain quelques jeunes garçons, jeunes filles qui attendent moi, qui penser, on t'a remis pour médecin qui j'aime capable faire etc.
Yes.
You know, moi, t'es toujours dit comme ça que c'est dans médecine mal parce que c'est ça que t'es toujours fait content. Les moi t'es si moun moi t'es voulu pour moi un pédiatre. Après ça, l'aime venir dans l'aime commencer medical school, commencer à apprendre toutes cellules yo, tout type de tissu etc. Qu'on y a me dit non, son pathologist moi voulait pour moi. En fait, moi j'ai fait une année de pathology dans UMass University. Mais dans la vie, moi c'est qu'on a besoin pour toujours aller côté bon Dieu voyo.
Yes, yes.
Même son père, parce que I loved OBGYN when I did the rotation. I really loved it. But moi t'ai vraiment pensé, oh, moun sa yo levé bien bonheur, yo levé depuis à 4h du matin, fait déjà dans l'hôpital là. Et puis, est-ce que moi capable faire ça? Et puis, j'en ai eu pour abrer les sous moun. Est-ce que moi capable tolérer moun qui pédérer les sous moi, etc. M'devine dire comme ça que, ok, m'ba croire que ça pour moi. Mais moi t'ai fait une expérience. Pendant moi t'ai fait 1 an de pathology dans UMass là, m'a demandé bon Dieu direction. Qui ça m'ta fait? Parce que me voulais pour faire bagage qui m'a content avec lui parce que on connaît dans la vie on choisit ça qui bon pour moi ou mettre passer une journée qui terrible mais bon Dieu a Kembo la passer avec qui très très important pour leur faire décision dans qui profession braler m'te prier bon Dieu et puis pendant dans UMass là c'est une gros institution qui gagne pile monde qui braler moi t'a braler dans lunch donc c'est un gros cafétéria. Peut-être que capable gagner n'importe 500 moun dans cafétéria tellement grand pile moun. Gen une dame qui est enceinte, li pas aucun autre moun pour l'ouer, c'est moi même li ouais, c'est même pas li prend, li dit comme ça aider li. Et puis pendant la dit aider là, qu'on y a la tomber devant moi, m'oblige à kembe li, c'est parce que la très ça devant moi. Et moi te prend ça, évidemment m'aider li, me voyer, me chercher moun qui pour aider li puis évidemment te prend ça comme un signe parce que m't'a demandé bon Dieu pour signe. Donc là bon Dieu, là demandé bon Dieu pour signe, pas oublier, elle voyer signe pour faut tendre. Donc moi te tendre et puis c'est ça que t'es madame non in my journey.
Doctor, it has been such a pleasure having you here this evening. It was awesome. Listen, you're not a stranger. This is your show, so I'm expecting you to come back. Thank you so much.
pleasure.
What can you tell the people? Because my time is up. My producer's saying, let's go, Lady T. Your time is up. So one last word before we're done.
Yeah, so I'm Laura DeRosier, urogynecologist at Doctors Hospital. I'm happy to see you if you're having any of these issues that we talked about today, urinary urgency, frequency, if you're considering minimally invasive surgery or would just like to know if you're a candidate. I would be happy to see you. I can be seen on, we have Centerville Medical Center, which is on Collins Avenue, and the telephone number is 242-302-3250. Again,